everyone. Today I am giving you information on the topic cataract part 5, in which we'll discuss about how to calculate the axial length. As we have seen in the part 4 that we have the IOL master, which is used to calculate the intraocular lens power very accurately. But in some cases, for example in case of vitreous hemorrhage, in case of highly developed cataract, right, like Metcat cataract, posterior polar cataract, and the highly developed cataract, it is not be able to give the axial length of the eye of the patient. So in those cases, what to be done? We have the two methods. First one is the immersion, and there are the two types of immersion. Then we will calculate by using that immersion methods or the contact or non-contact A scan we will do to calculate the axial length of the patient, because it is very important. Both the factors are important. First one is the keratometry values, which one is the K1 as well as the K2, steep and horizontal meridian of the cornea, as well as the axial length, to take out the or to do the biometry or to calculate the intraocular lens power for the patient. So let's see both the methods one by one. First one is the A scan by non-contact, and the second one is the A scan by contact. Okay, so in case of A scan by non-contact method, the immersion technique requires use of a Prager scleral shell or a set of Osning and the Hazen scleral shells. Okay, this one is the scleral shell. Okay, this transparent part is known as a scleral shell, which we are using to calculate the axial length of the eye of the patient. Okay, so first of all, the patient lies in a supine in the anesthetized condition. We will put the parakin inside the eye of the patient. For example, this one is the right eye and this one is the left eye, and we are going to take the measurement of the right eye of the patient. Then we are supposed to put the parakin inside the right eye of the patient, and patient should be in that condition as I have shown you. Now, looking up at the ceiling, and the scleral shell is placed between the eyelids and centered over the cornea. Now the examiner have to take the index finger as well as the thumb to pull out the both eyelids, lower eyelid as well as upper eyelid, and insert this Prager shell inside the eye of the patient without touching the cornea. Okay, align the ultrasound beam. Next one, the scleral shell is then filled with the solution. Okay, the scleral shell is connected and it is filled with a solution. Now in this scleral shell, the solution is filled by inserting it from a syringe. Solution is placed inside it, and then align the ultrasonic beam by the macula, having a patient look at the tip fixation light, then simply take your reading. Okay, ask the patient to look at the ceiling. In this probe, the red color light will be appear at its tip. Okay, the patient is supposed to look at the red light, then the macula will be placed properly in that position where we are going to take the readings. Okay, then if the patient will look at the red light, then automatically then the readings will come. Okay, so then in this way we will take the readings easily of the axial length. If there is a doubt, then we will repeat the procedure 2 times or 3 times, and can also compare the axial length of the both eyes. Okay, if there is a doubt, right eye and then the left eye, mostly we have to compare the axial length of the both eyes. Okay, in order to safer side or going through the accuracy. Next one is the A scan. This one is the another method, which is by the contact. Now in this case, the patient is in sitting position. Okay, this one is the position of the patient in contact A scan. The patient is in sitting position and looks straight at the given target. Will give any target to the patient, and the patient have to look at that target only. Okay, put local anesthesia in the eye and keep the tip of the probe slowly on the cornea of the patient. Put 1 drop of paraffin inside the patient eye and 1 drop of paraffin at this probe, and give the target to the patient, and slowly we will introduce the probe and touch the cornea of the patient with the probe. As the patient will look at the straight position, then the readings will come. Okay, take out the respective readings of the axial length. We'll take out the axial length from here and take the K1 K2 values from the autorefractometer. Then in this way we will calculate the IOL power of the patient, which we are going to implant during the cataract surgery inside the patient eye without using the IOL master. Okay, due to its limitations. Next one, now what are the limitations? In contact method, the probe touches the cornea. Okay, now in this case the probe touches the cornea, as we all know that the cornea is very sensitive and may result in the corneal compression. Sometimes cornea get compressed due to the touching, and sometimes we will repeat the procedure and cornea will get compressed and gives the shorter axial length. Axial length or accurate axial length is very important to do the biometry or to give the proper lens power. So corneal compression will not be done. To avoid this, we will use the immersion method, because in this case there is no corneal compression. Okay, so mostly the immersion method is used. In very rare cases we will use the contact method, and it is very important to compare the axial length of the both eyes, because it is almost same. Point 0.2 to 0.3 is difference is there, but it is almost very same in order to going through the accuracy. Next one, treatment of a cataract. Now what are the treatment of cataract? Symptoms of early cataract may be improved with new eyeglasses. Symptoms of early cataract, when there is a starting stage of the cataract, then it may be improved by giving the new eyeglasses, brighter lighting, anti-glare sunglasses, or sometimes we will give the magnifying glasses to the patient. If these measures do not help, surgery is the only effective treatment, which involves the removing the cloudy lens and replacing with the artificial lens. Okay, so in case of early cataract, we will always provide the eyeglasses to the patient, use the different methods to improve the quality of life of the patient. But when these measures do not do any kind of help, then surgery is the only treatment to remove the cataract. Next one, cataract needs to be removed only when vision loss interferes with your daily activities. Okay, cataract always need to be removed if you are facing the problem in doing your daily activities such as driving, reading, watching television. Your daily activities are hampering, then you have to go for the cataract surgery. And sometimes you and your eye care professional can make the decision together. Okay, sometimes delaying the cataract surgery make very difficult for the surgeon to perform the surgery, and it will not give the better results. So it will be the decision of both the patient as well as the examiner or your eye care professional. So understand, always understand the risk factors properly, and then the decision should be taken for the surgery. Next one, if the patient have the cataract in the both eyes at the same time and require the cataract surgery in the both eyes, then every time the cataract surgery is not performed in the both eyes at the same time. Okay, the cataract surgery will be performed on each eye at the one time. Always we will start from the right eye first, but in some cases we will choose the better eye first. Okay, in some cases we'll choose the better eye first. In most of the cases we will choose that eye which have the more cataract. Okay, if the patient have the cataract in the both eyes, then the person have to take out the gap of the 20 to 25 days, will get satisfied from the one eye, and then go for the another eye's cataract surgery. Okay, it will not be performed for the both eyes at the same time. Have to take the gap of 20 to 25 minutes, 25 days, get satisfied from that treatment, then go for the another surgery. Next one is effectiveness of the cataract surgery. Now cataract removal is one of the most common operations which are performed in the US. It is also one of the most safest as well as the most effective type of the surgery. In about 90% of the cases, people who have cataract surgery get better vision afterwards. Okay, it improves the quality of life of the patient, it gives the colors to the patient. So this was the effectiveness of the cataract surgery, that about 90% of the cases the patient should be happy after doing the cataract surgery, and it is one of the most safest as well as the effective type of surgery which is performed in US as well as is performed in our country also. Thanks for your patience listening.